Diabetic nephropathy is a serious kidney-related complication of type 1 and type 2 diabetes, affecting the organ's filtration ability. Chronic high blood sugar levels damage the delicate microvasculature within the kidneys, initiating a cascade of structural changes. One of the earliest histological signs is the thickening of the glomerular basement membrane, which impairs the selective filtration barrier.
Excessive accumulation of extracellular matrix causes mesangial expansion, which reduces the surface area available for blood filtration. The loss of specialized cells called podocytes weakens the filter, allowing large molecules to escape into the urinary space. This leakage results in microalbuminuria, the first clinical indicator that the kidneys are beginning to fail due to diabetes.
Hormonal imbalances increase the pressure inside the kidney filters, accelerating the rate of tissue scarring and damage.
Advanced stages are marked by the formation of Kimmelstiel-Wilson nodules, signifying severe and irreversible glomerular scarring. Strict management of blood glucose and blood pressure is essential to slow the progression of diabetic renal disease.